Beginning a telehealth program is an investment of your organization's time and resources. Like any new undertaking, it will involve research, analysis, planning, and a host of other activities to be successful. All too often, programs begin because there is a staff member who's very enthusiastic about telemedicine. There is available grant funding, or someone just thinks it's the thing to do. These are all acceptable reasons to consider telehealth. However, before you implement your program, we suggest you stop and perform an organizational readiness assessment to determine if telemedicine is a good fit for your organization and if this is the right time to consider it. Let's take a look at the steps in an organizational readiness assessment. Step 1. Describe your proposed program. What kind of telehealth services are you considering? How large is your anticipated program? Do you have any estimate of the anticipated service levels? Are you implementing 2 or 3 critically needed outpatient specialty services at a patient site, or are you implementing telemedicine-supported intensive care services at a major medical center?
You need to figure out what are your objectives, what are the goals, what do you want to achieve by having this new program come in to your establishment. What are you trying to achieve?
Step 2. Determine the current state of your organization in relation to the telehealth program. It's hard to not find telehealth programs exciting, but it is important to know that your organization is ready and aligned to take on a telehealth project. Think about the following questions. A companion worksheet is available at the CTEC website. If you find areas where you may not be quite ready, you can begin the process of informing, educating, and enlisting support for your project. Does the proposed project align with the organization's current vision, mission, and strategic plan?
I think the most important aspect that I've seen in successful programs that have duration and endure is that they've really tied their telemedicine or telehealth program to what the mission of the organization is, so that they really thought about what they're trying to accomplish in terms of outreach or access to specialty care and a population they're trying to serve, or a linguistically or culturally appropriate population, and that they've tied telehealth to that.
Is your proposed project consistent with the organization's values and culture? Every organization has values and cultural norms. It's important to consider if your organization's culture supports innovation and clinical technology applications.
What is your culture that is currently going on in your hospital? How will your clinicians adopt this change in the way that healthcare is delivered? We didn't realize some of the culture that was within the ICUs that could impact the ability for physicians and nurses to adapt to a change in the way that healthcare is delivered.
Are resources available to begin development of the proposed project? The project may be a great idea, but do you have any funding or staffing for the initial planning activities? Is your idea competing with other initiatives that will compete for resources? Can telehealth support these initiatives?
Symptoms of readiness, I suppose, would be that the staff is truly freed up from other duties to really work on this, and that the medical staff are given time to think about the services that they want to offer. I think if an organization is truly committed, that they will really give the time for the program to launch.
Does your proposed program have a champion? Every successful telehealth program has a champion. Does yours? Is there a clinician championing the project? Is there an administrative champion for the project? Can you begin to enlist others to become supporters of a telehealth initiative?
We had a dedicated psychiatrist who really believed in this process. We had the backing of administration. It was a risk because it was costly to buy the equipment and take a chance with it, but it was well worth it.
Will stakeholders support the program?
You really need to have your chief medical officer or your CEO or whoever is kind of the key person in your particular facility being there for you and helping you through the roadblocks that you may encounter.
And from the very beginning, we cautioned ourselves to make it a patient service solution that would benefit doctors and patients alike and was technology enabled.
The staff members running a telemedicine program need to have the support of an administration. They need to be able to go to administration to ask them questions.
There really needs to be a commitment to the process and that everyone really understands what telemedicine is.
There are many stakeholders involved in a telehealth implementation: clinicians, all types of clinical staff, administrators, information technology staff, board members, patients, community organizations, and others. Do you know what the perceptions of your major stakeholders are about the proposed program? Are stakeholders educated about the proposed program? It's never too early to begin communicating with your stakeholders. Who has authority over the proposed program? Who will need to approve your project? For example, will it need to go through your board of directors? Are the decision makers aware of the idea, and are they supportive? Identify your organization's strengths and challenges. What areas of strengths will support telemedicine implementation? Are there challenges within your organization that might hold your program back? Are there business opportunities in your marketplace that would help your program succeed? For example, are there any community health initiatives that your program would enhance? Have any new reimbursement or coverage provisions been implemented that would support your proposed program? Are there barriers in the marketplace that would hinder your success? Are there rules, regulations, or policy that will impact your proposed program? Next steps. Answering the previous question should give you a good idea about whether your organization is ready to undertake a new program implementation. If not fully ready, the assessment should give you a clear picture of what specific areas require attention before proceeding. After making any necessary organizational adjustments or changes, review the assessment worksheets again to help ensure that you are ready to move forward. When there is agreement that the organization is ready to move forward, a structured program development process can be extremely beneficial in keeping your implementation on track with a minimum of problems.